Hello everyone, welcome back to my channel. So now we are continuing our previous talk about craniosacral junction, and I just want to focus on spinal cord injury here. So we already know patient had craniosacral dissociation, and we're going to expect with this serious injury we're going to have some findings in the spinal cord and the spinal canal. So let's first look at the cervical spine, as you see here. So the brain itself doesn't look that much bad, right? The brain, whatever we see in the brain, looks pretty good. But when you look at the cervical spine and the cervical cord, up to here is just like a start at the lower aspect of the cervical cord and also upper thoracic cord. You see that this is just like a lot of hemorrhage and a lot of like avulsion injury and contusive injury in the spinal cord, and looks like the diameter of the cord actually almost doubled. If you look at the normal cord and then you look at the normal canal, and then you see that okay, suddenly it's just like so here I will talk about that, but you look at the canal, so the diameter of the cord actually is just doubled and looks like the filling the thecal sac entirely. So this is the spinal cord injury with almost avulsion and hematoma and hemorrhage, and part of it actually is just transaction of the cord as well, because you just see that there is just like all hemorrhage into the substance of the spinal cord. When I look at this carefully on this sagittal sequence, I see that there is some sort of like asymmetric fluid signal in this space that looks like epidural collection. If we look at the axial, you see that basically there is a fluid signal in the ventral thecal sac that actually exerts mass effect on the cord. If you just come down, you just keep continuously coming down all the way up to here, and then it disappears when we see the actual cord injury. So this patient, besides having this spinal cord injury, also has some epidural collection that is extends from the C2 almost to the level of C7. It has some mass effect on the cord, and also it's just CSF vasointense. It can be due to this tear that we see in this area. They might have some CSF leak here, but let's keep looking. When we look at the thoracic spine, so we already know that this is the extensive upper thoracic cord injury. Then we're just coming down, and then here we're just going to see some signal over there, and also we see some signals here. Let me show you the T1 sequence very quickly. So when we look at the T1 sequence, we're just showing it better for us. We see that this area, there is some fluid collection in the dorsal epidural space of the distal thoracic spine and upper lumbar spine. And if you look at the actual T2 sequence, you're going to see this layering fluid back there, which is basically dorsal epidural collection. As you see here, basically there is a line here, and this is the fluid which is in the dorsal thecal sac. When we go more down, then we're going to see also some areas of subarachnoid hemorrhage in the actual thecal sac. And if you look at the sagittal, it's going to show up like this. So basically you see that this area that we are seeing like the distal spinal cord, and this is the conus, and then we see this dorsal epidural collection that just showing right there, and then here we see some layering fluid in the distal thecal sac. Basically this is a subarachnoid hemorrhage. So if I go up here again, so we see this is a conus, this is the epidural collection, and then all the way down, when we come down, you're going to see some areas of subarachnoid hemorrhage. So basically we see different type of hemorrhage. We see actual spinal cord injury in the substance of the cord with hemorrhage with increased diameter and swelling, and then we see different type of epidural collection right there. This is the ventral collection, and then here we see, so this is a stir sequence. It's going to be a little bit difficult to see it on that, but if you look at the T2 sequence, or if you look at the T1 sequence, you're going to see that this fluid basically is on top of the dura. So basically this is the dorsal aspect of the thecal sac, and this the fluid is just compressing on it. So basically this is the epidural collection in the dorsal aspect, and then this layering fluid down there is going to be subarachnoid hemorrhage. Thank you for your attention.